I have the privilege in awarding the 2013 award to Amanda Pollard.
There are plenty of people that deserve this more than me, especially this year. But thank you very much indeed. Not everyone here will know about the Care Quality Commission, the CQC, and the Mid Staffordshire Public Inquiry. The Care Quality Commission is the regulator in England for hospitals, healthcare, nursing homes, dentists and GPs. It's very likely that you won't know about my role in the inquiry. I gave evidence as a CQC inspector. I had previously worked for the National Infection Control Team with the Healthcare Commission, and whilst everything was not as good as it could be, the national teams seemed to have good reputations and be effective. The regulation that covers infection control is detailed and involved, but the team received good training, support and expert backup. I saw for myself wards with dirty environments and poor infection control practice change for the better after hospital board focus following some of our inspections. The Healthcare Commission merged with the regulators for social care and mental health to form the Care Quality Commission. Change can be difficult for staff, and everyone was aware that we really ought to see this as an opportunity. We learned that most of the national teams would be disbanded, even though they were a good blueprint on how to inspect. We were then told we were to become generic inspectors, and those of us from the Healthcare Commission would now also be responsible for inspecting nursing and care homes, and those from social care backgrounds would be responsible for also inspecting hospitals. We, the inspectors, started to become genuinely concerned about the repercussions of inspecting sectors for which we had no experience. We imagined training would fill the gap, but even then it was a tall order. But no training happened. I was very happy and confident about inspecting for infection control, but had no experience whatsoever of dementia care, mental health care or learning disabilities. Equally, colleagues with no healthcare backgrounds were now expected to inspect specialist hospital services with no background experience or training. The first time I went into a nursing home was to inspect it. The CQC expected us to hit the ground running, a phrase which I now view with much suspicion. This wasn't right, so I wrote to the CEO at the time, Cynthia Bauer. In my letter, I likened her position to an airline captain, and I explained how things are when they go wrong in the cockpit. Captains are trained to stop and listen to their first officer. If the first officer says the phrase, "Captain, you must listen," the first officer will probably be less experienced, but may be able to see a bad situation happening which has escaped the captain, and it has happened before. I finished with my letter to Cynthia with the phrase, "Captain, you must listen," but she didn't. Things were getting worse at the Care Quality Commission, and to appease the Health Select Committee, the CQC issued inspection quotas that were potentially encouraging inspectors to view homes with a tunnel vision and inspect the minimum number of outcomes, be quick and get the report off quick. I then heard that the National Audit Office were reviewing the CQC, so I wrote to them. I included my name, but I asked for anonymity. An office worker at the NAO then contacted me and suggested I should contact Public Concern at Work. I can remember thinking at the time, this is useless, they're never going to do anything. But I called them, so at least I'd done what was asked of me. But I was wrong, because it was a good move. Public Concern at Work put me in touch with the lead solicitor for the Mid Staffordshire Public Inquiry. This was the second inquiry about Stafford Hospital, and it was tasked to uncover how wider healthcare regulation allowed the disaster at Stafford Hospital to happen. They were looking at the role of the CQC. I clearly remember the phone conversation with the inquiry solicitor about waiving my anonymity, and his view was, "Why are you worried? Your job is protected under PIDA." But I wasn't so sure. But by then it felt like someone needed to break ranks and say something. If change was going to happen, it required a face and a name. The CQC didn't react well, and even before my appearance at the inquiry, the Chief Exec and also the Chair, Dame Jo Williams, had put messages out on the intranet and in emails to staff condemning me and Kay Sheldon, Kay is a non-executive board member who'd followed a similar path, contacting the NAO and then the inquiry about her concerns about the CQC. I appeared first at the inquiry, and then Kay appeared in the afternoon. I think we gave a powerful message with me setting the scene about how bad things were at the coalface, and Kay's evidence then describing how bad things were at the board level, which explained the concerns that I had. A few months after giving evidence, I wrote to the Public Accounts Committee outlining my concerns, which, despite the inquiry, because it hadn't reported yet, were still very much happening at the CQC. I recall asking the Secretary to the PAC about job protection and giving evidence to the PAC, and he replied, "You're covered by parliamentary privileges, and that trumps the inquiry protection." So great, I thought. I'm not able to discuss today what's happened to me in my role since I gave evidence for legal reasons, but I left the CQC a few months ago in March. That said, I did approach the Public Accounts Committee again on more than one occasion to explain what was happening to me at work. The same secretary said that he'd pass it on to the Minister, but I didn't hear anything again. The PAC are aware that I've now left my job, but I've yet to hear anything from them. The inquiry, however, have maintained a quiet but supportive role, always in the background, but I feel that they've supported me in whatever ways they've been able, and that goes equally for public concern at work. So how should an organisation respond to whistleblowers? I think there's a vicious circle at work here, and good leaders create good organisations that don't need whistleblowers because they largely get things right. When things go wrong, they listen and they soul search for answers, and this doesn't rely on structures or systems as much as having good people in key posts. I've worked in organisations like that, where the need to whistleblow at a public inquiry would be utterly unimaginable. They don't ignore concerns from staff or bully them into silence. I personally feel that if staff have a genuine need to whistleblow outside the organisation, then the organisation probably isn't competent to be left to deal with the concern. And for the NHS and social care, this means going to the CQC. So for organisations without good leadership, we need to be thinking about how we protect whistleblowers. PEDA makes some protection for whistleblowers who are sacked as a result of making some protected disclosures, but it doesn't help those who are bullied out of their jobs. And taking an organisation to court is a very expensive business, making it an impossible option for most people. It's little wonder that there are so many disillusioned whistleblowers out there. I attended a primary school at Kingsbury, and it's not far from here. Back in the 70s, the headmaster was one of a diminishing type. He was old school, proper, always well turned out, but very approachable and decent. And I can clearly remember one morning assembly, and I must have been about 7, and Mr. Mortimer reached inside his jacket and he pulled out his pen. It was probably a lovely pen, and I can't imagine for a second it was a biro. And he held it up and he said, "This is the most powerful weapon you'll ever own." And we sat there expecting a lecture on not using pencils as darts, but nothing so mundane from Mr. Mortimer. And instead we heard that if we see a truth that needs to be known, writing honestly and openly about it can be the most powerful weapon that brings about change. And it was a lesson well learned for me. Thank you very much for the award.